from Guppy's Power Sports here in Grapevine, Texas. Thanks for tuning in. I know I told you guys I was going to try to come home after my surgery yesterday, which was April 8th, on my left shoulder, my rotator cuff, bicep tendon, and everything else that was messed up in there. I know I told you all I would try to give you an update yesterday. Well, when I got home, I was feeling pretty groggy from the anesthesia. Yeah, I was pretty much out of it, so I didn't really want to do it. I wanted to, but I just didn't have the energy to get up and do it. Well, it's 3:30 in the afternoon here at day 2, and I figured I'd kind of give you an update how everything went on the surgery, how I am progressing, how I'm doing here, and just tell you a little bit about what happened yesterday. Well, 6:30 in the morning, we left the house here, drove the 30 minutes down to Keller, to North Texas Orthopedic Surgery Clinic in Keller. Got there, I was supposed to be there at 7:15 in the morning. My surgery started at 9:30. I believe they were done in 45 minutes. The doctor came out and briefed my wife, said everything went really well. They got the shoulder through arthroscopic surgery, but the bicep was pretty messed up. They had to give me about a 3-inch incision to repair the bicep, but it is fixed. They used a nerve block. So last night when I got home, I didn't feel no pain whatsoever. I was just really tired and groggy from the anesthesia. And anytime I moved, kind of felt I wanted to maybe throw up or real queasy. So I decided not to do my day 1 post-op for you guys. I apologize, but I'll just tell you, it went good yesterday. The people at the clinic were awesome. I really like my doctor. If it's something you need done and you're in the Dallas-Fort Worth area, it might be something to think about. Dr. Staley out of Grapevine, and that clinic was really good where they did it. They were very clean, thorough, professional. They really were there to take care of me, and I really appreciate that. They made me feel real comfortable. I had no anxiety going into the surgery because I had the one done in 2003. Last night, I didn't sleep very well for the same reason. I was really groggy. I slept on and off a little bit, 20 minutes here, 20 minutes there. So I didn't really sleep very well. I'm pretty tired. Doing the same thing today, sleeping about 20 minutes here, 20 minutes there. That pain block, when they gave me that pain block, it was like my whole arm went totally paralyzed. And it didn't scare me because the anesthesiologist was awesome there. He explained everything to me in great detail. Another great guy. I wish I could remember his name. Awesome guy there. If I could get his name, I'll re-update the link on the bottom and tell you what his name is. Awesome guy. Now, I'm not a medical professional at all, so I'm not telling you any way how to take care of your stuff. If you go through this, you got to follow your doctor's instructions. I'm really following my doctor's instructions to a T. Trying to anyways. He told me when I come home, start taking the pain meds. So I started taking one of them. I didn't really take it right away. I took it right about midnight. At night, he said take it before you go to bed, because just in case this, if the nerve block goes away, that it could take care of the pain. Well, the nerve block did really well until this afternoon. That's when it started going away this afternoon. About 1 o'clock, it started, the nerve block quit. And it's not 100% quit. My arm still feels numb, but it's going away, and I'm starting to feel pretty good pain on it. But I did exactly what he said. Started my pain medicine last night. I've been icing my shoulder since I've been home all the time with that Bragg Polar Care Cube. Been icing that shoulder pretty much all the time. I'm not now because I'm in here making this video real quick for you, but as soon as I get done, I guarantee I'll be back in there on that thing because it has really done good. Constantly icing it. I'm not having as much pain right now as I did on my first shoulder. So that's great news for me. I'm real happy about that. I do have some pain. Anytime I move, it really tightens up and just makes me wince, but I'm gonna get through this. Like I said, I'm following the doctor's instructions. I just really wanted to give you guys a quick update. I'm doing well. The queasiness is gone today. I'm able to move around a little bit better. I'm not as tired. I started my exercises last night that they called me. I got to do, I got to take the sling off, and my doctors instructed me to hang my arm, just let it dangle, and do forward and backward motions with my arm bent over, leaning on a chair or desk, and I just swing my arm forward and backwards 5 times. Then I go side to side 5 times. Then I do as big a circles as I can. And what it is just to keep my shoulder loosened up so it doesn't get real tight. So I don't have to go through therapy loosening that up. And then it gives me what's called a range of arm motion. That's my left arm all the way straight out, and I bring it up. With that nerve block on there, I could not move my arm. I couldn't move it at all. I couldn't even move my fingers. I just didn't have no feeling. It was like it was paralyzed. So yesterday I did that with my arm. Me and my wife helped me. We would lift my arm all the way up. I did that 5 times. This morning, I've already done that set exercise once this morning. I did them right after lunch. Tonight after I eat dinner, I'll do it a 3rd time. They want me to do that 3 times a day. I noticed today for lunch, I was able to actually use my own arm to do my range of arm motion to pull up the bicep. Because again, like I told you, the nerve block was wearing off. So if you ask me, Kurt, should I get the nerve block? Discuss it with your doctor and your family and stuff. For me, I feel it worked well on me, but I'm not you. And need to make sure if that's what your doctor wants to do, just talk it over with him and you can make a decision. But again, I'm not a doctor, I'm not a nurse, I'm not a physical therapist. I work on trains and I take pictures and I make videos, and that's what I love to do. So I'm not a doctor, I'm just trying to give you guys some information that if you have to go through this, that hopefully helps you. I can tell you that things that helped me so far definitely is following the doctor's care instructors to a T and using that polar care cube, that ice, that cooling therapy. That has really worked really well. It stays up there well in the shoulder. Don't put a lot of weight on my shoulder. Now that my shoulder's starting to hurt, I feel it up there, but it's not like if you plunked a bag of ice on top of my shoulder. I still have the dressing. The dressing is really huge because, of course, they had a big incision, so it covers a lot of my shoulder. So with that being said, Monday, I can't wait. I get to take the dressing off, and then I'll be able to put the polar care back on there, and that cooling will get in there deeper into that joint and help remove that inflammation. So with that being said, that's where I'm at on day 2. I'm pretty happy so far with the way it's going. I've not had massive pain. I've had pain. It makes me wince, but it's not really intense. So I'm happy so far with the progression as I'm going along here. I'll probably come back tomorrow and just tell you how I slept through the night and how it went. It'll probably be another real short, quick video like this one. Like I said, it's not going to be very long, just quick little updates and tell you what I'm doing and how I'm feeling. I just want to hurry up and get back to this so I can get my camera up and take some pictures and make some more power sport videos, side-by-sides, boats. I'm hoping I can get into exotic cars soon. I've reached out to some people. I'm trying to make some contacts there. I just want to offer the channel a lot more stuff. And in the meantime, while I'm out, if I could use this time to help someone else who's got to go through a shoulder operation, that's great. And that's what I'm going to try to do. But I appreciate you all tuning in. If you like this video, do me a favor, hit the like button. If you want to see day 3, day 5, day 7, 10 days, 14 days, 2 weeks, a month, definitely hit the subscribe button so that way you're notified when it comes out. You get that little red dot by my name. But if you want to be really notified, hit that notification bell and they'll notify you, say, Guppy's Power Sports got another video out. And for some of you guys don't know, I have also Curtis Landry Photography is another YouTube channel that I have, and Curtis Landry Photography, that's my side business that I do. Appreciate you guys tuning in. Do me a favor, you power sport riders, you get out there, you ride hard, but man, ride safe. To you photographers, man, take that camera out, take some pictures. Thanks, guys. Be careful. Bye.